to you about cholesterol controversy. I must thank Dr. Vijayakumar because he has allowed me to go into various websites and gather some information for this particular talk. This morning, when I was sitting in the clinic, I had to treat one patient with a problem of hypertension. He had an accelerated stage and he was admitted in a hospital with epistaxis. The blood pressure was controlled. He had the lipid profile done there, and the LDL cholesterol was 176, the HDL was about 29, and no anti-lipidemic drugs were prescribed for him. He came for my consultation here, and I started doing it again at the end of 3 months or so. I told him, it is raised, you need to take some treatment. Why, sir? There are a lot of problems with cholesterol and statin therapy. And I don't think we require drugs to manage cholesterol. We do get information on a daily basis. I had to take a class for him for next 10 minutes, convinced him to take statin. That is a scenario what we are all now experiencing in our clinics. I'm sure the same experience is also there in you. I would like to ask you 2 questions. One is, do you believe in any medical news sent by individuals through SMS, WhatsApp, or email? Do you give importance to randomized controlled trials, meta-analysis, expert consensus statement, guidelines from various academic bodies? Which one you would prefer? As a medical doctor, which one will you prefer? Okay, fine. There is information which I thought I should probably share with you, which had been actually making a lot of rounds. A viral information. Since we cannot possibly eat enough cholesterol, our body makes its own. When we eat more foods rich in cholesterol, our bodies make less. If we deprive ourselves of food high in cholesterol, such as eggs, butter, and liver, our body synthesizes cholesterol. Eating foods high in cholesterol has very little impact on our blood cholesterol levels. 70% of the population, foods rich in cholesterol cause only a subtle rise in cholesterol levels, or none at all. In other 30% of the population, these foods do cause a rise in the blood cholesterol levels. Research has never established any clear relationship between the consumption of dietary cholesterol and the risk of heart disease. Raising cholesterol levels is not necessarily a bad thing either. This is a dangerous information which has been going on for the past 3 years or so in the social media. It was almost a continuous, uninterrupted information, convincing the publics and confusing the doctors. Number of questions raised by our patients, relatives, and even by our colleagues. Doctors are requested to stop statins by their own patients. Do you know this? Delivery of exogenous cholesterol to the hepatocyte inhibits the synthesis of new LDL receptors and downregulate the reductase, HMG, the rate-limiting enzyme in cholesterol synthesis. So dietary cholesterol suppresses the uptake of plasma LDL, thereby increasing the plasma LDL levels as well as inhibiting the hepatic cholesterol synthesis. Way back 2006, S M Grundy, who is a well-known specialist in the field of lipidology, who had come out with a lot of guidelines, including NCEP, ATP 1, 2, 3, and 4. He had published the data, 68 clinical studies, 1,490 patients. There is a positive and significant correlation between increase in the dietary cholesterol intake and the average change in the plasma cholesterol levels. Now let me take you to the statements what are appearing in the social media through internet sites. There is no link between cholesterol and heart disease. Cholesterol, read about the facts and myths. High cholesterol does not cause heart disease. From where do we learn modern medicine? The answer is simple. Neither from WhatsApp or internet or from lay press, such as your Indian Express or Hindu or Times of India. We always believe in the standard textbooks information, the journals, reputed one, the national and international medical conferences when we attend, and the CME programs. We do refer to important internet sites and always probe for the evidence base for each of the internet sites. How do guidelines are all coming out? The guidelines are based on evidence. Where does evidence come from? It is coming from randomized controlled trials. Where does it come from? From meta-analysis. You believe in all the statements given by ACC, AHA, ESC, and all sorts of associations, including Cardiological Society of India, of course, even Lipid Association of India. When we released consensus statement for first one, the second one, people started praising us a lot because they like it. Because always we depend on these sort of guidelines or the consensus statement to improve our practice or implement in our clinical practice. So these are the sources of continuing our medical education, not the social media. This is a famous site, Mercola.com, described as the #1 health website. Dr. Mercola describes himself as a new apostle of fat advocacy. He bases all his conclusions on the 2010 recommendations advised to the Americans by the US Department of Agriculture, Health and Human Services. No way it differs from the old ATP3 guidelines of NCEP, National Cholesterol Education Program, Adult Treatment Panel 3, and the American Heart Association endorsed statement. And we had been following it right from 2002. Mercola, he started giving some message in the internet sites. And through social media, he continued to spread the rumor that 2015 new guidelines might lift the limits of dietary cholesterol. It had happened. Every 5 years, the United States used to get a recommendation from the Department of Agriculture and Nutrition how to improve the nutrition in children, how to improve the nutrition in adolescents. And they have not specified anything for the patients who suffer from heart disease, diabetes, or hypertension, or people above the age of 40 years, nothing. They would like to improve the nutritional status of the youngsters. So that recommendation was coming every 5 years. So this man had predicted it. They are going to probably come out with some sort of new guidelines. It had happened. What is the statement? Cholesterol is not a nutrient of concern for overconsumption. This is a very controversial statement. There were lots of criticism from many circles. Immediately, the Harvard University School of Public Health started releasing this statement. Very important data, because the US Agriculture Department Nutrition started telling you can eat any number of eggs. There's no problem. No need to restrict it. When eggs may not be the optimal breakfast choice, they are certainly not the worst, falling somewhere in the middle on the spectrum food choice and the heart disease risk. For those looking to eat healthy diet, keeping the intake of eggs moderate to low will be the best for most, and emphasizing on the plant-based protein options when possible. A controversial study appeared in BMJ. Flawed cholesterol study makes headlines. A controversial study that argued that if you have high LDL cholesterol, when you are aged over 60 years, you will live longer. You will live longer. There is no increased risk of cardiovascular disease, and that statins will have little effect. This is the publication in BMJ, Open Journal. These people actually started looking at about 70,000 people in the retrospective study, came out saying that there's no link between what has traditionally been considered bad cholesterol and the premature deaths over 60 years of age. 92% of the people with a high cholesterol lived longer. The authors concluded that high LDL-C is inversely associated with the mortality in most people over 60 years. The finding is inconsistent with the cholesterol hypothesis. They raised some questions. It is now reason for us to raise a question for the validity of the cholesterol hypothesis. The study also provides a rationale. Why do you make recommendations for people above the age of 60 years to take statins? There is no need. Things will change. These were the comments given by these people. Immediately, the media was attracted by their statement and by this publication of this journal in BMJ. Like Daily Mail started giving information, Guardian, Independent, Telegraph, BBC Radio 4, and others. The Daily Mail started saying, statins may be waste of time. Controversial report says no link between bad cholesterol and heart disease. And then the bad cholesterol helps you live longer. That is the Times message. There were many, many flaws in this study. There are limitations in the study. They actually did not concentrate on many relevant studies. That's number one. They did not concentrate on other lipid parameters. The possibility that the health and lifestyle factors are also interfered in this. Most importantly, the researchers themselves acknowledge that they did not take into account the ingestion of statins by these people above the age of 60 years. They were all taking statins. People found to have high LDL at the beginning of the study may have subsequently been started on statins, which became popular during the study period and could have prevented deaths. 4 of the study authors, they have previously written books on criticizing cholesterol hypothesis. It should be noted that 9 of the authors are members of the THINCS, THINCS, the International Network of Cholesterol Skeptics. This is described as a group of scientists, I need to underline that, who oppose animal fat and high cholesterol play a role in the genesis of heart disease. So having said all this information, can we trust these bold claims? Immediately, the British Hypertension Society took the responsibility, started telling us they relied on limited, aggregated, inconsistent information and approach liable for bias. It was given by the professor of epidemiology of the British Hypertension Society. Evidence from large clinical trials demonstrates very clearly lowering LDL cholesterol reduces our risk of death overall. We need to depend on the evidence-based medicine. Periodically, we get recommendations on the evidence-based medicine in the form of guidelines. Even 2017 guidelines, 15 guidelines, all those guidelines never changed. They were almost keeping the NCEP ATP 1 as a basis, and they were building it up every once in 2 years or once in 3 years. We believe in that. So for our survival, let us stick on to the scientific evidence-based medicine. Statin saves lives of people with high levels of LDL cholesterol. Only about in the April 8th, 2018, it was published in JAMA. Analysis of previous studies involving more than 270,000 patients finds this who have high levels of LDL cholesterol should feel safe taking statins. This is a message which has to be borne in mind. How to assess the ASCVD risk in an individual? Do you know how to reduce it? The British Hypertension Society actually has come out with a statement, use heart age tool. The Lipid Association of India recommends JBS3 score, and you can identify what is the risk for an individual so that you can plan. Ladies and gentlemen, I will now take you to the publication in 2017 which appeared in Circulation. This is about the dietary fats and the cardiovascular disease. Key evidence to reduce saturated fat and replace it with the polyunsaturated fat, PUFA and MUFA. When you advise to reduce the saturated fat, you need to make the isocaloric diet. So you need to probably encourage the fellow to take PUFA, encourage the fellow to take MUFA, encourage the fellow to take complex carbohydrate. That's the best way. The PUFA is actually omega-3 and omega-6. One message that I would like to share from the American Heart Association. The one message is this: randomized clinical trials showed that polyunsaturated fat from vegetable oils, replacing saturated fat from dairy and meat, lowers cardiovascular disease. Very important statement going through various clinical trials. This is an excellent statement. Message 2. A dietary strategy of reducing intake of total dietary fat, including saturated fat, and replacing the fats mainly with the unspecified carbohydrates, does not prevent coronary heart disease. Message 3. Prospective observational studies showed that lower intake of saturated fat coupled with a higher intake of polyunsaturated, monounsaturated fat is associated with a lower risk of CVD and lower risk of mortality. It is much more with the PUFA than with the MUFA. PUFA and MUFA reduce the risk, whereas PUFA, in fact, has shown to reduce the mortality much more when compared to MUFA. Key message 4, saturated fat increases the LDL cholesterol, a major cause of atherosclerosis and cardiovascular disease, and replacing it with the polyunsaturated and monounsaturated fats decreases the LDL cholesterol. Replacing saturated fat with a PUFA lowers the triglyceride levels, an independent biomarker of CVD. Replacing saturated with polyunsaturated fat prevents and regresses atherosclerosis even in non-human primates. People have done studies on monkeys and they had shown. So ladies and gentlemen, having listened to this sort of statements from various associations and contradictory remarks, what I was trying to project as far as the cholesterol, what I can say, the messages which was coming as a dangerous message in WhatsApp. Let me now take you to the learns what we have learned from LDL lowering the journey so far. In the absence of hypercholesterolemia, raised LDL cholesterol or remnants, it is virtually impossible to cause atherosclerosis, even in an experimental model. This statement had appeared in arteriosclerosis way back 1933. I think all these fellows had not gone into those sort of details. So our attention should be to control the LDL and bring it down to the levels as much as we can. Must be on lowering LDL all the time and keeping it low throughout life, because randomized control trials which had used the statins, HMG coenzyme A reductase inhibitor, had shown beyond doubt, by lowering the LDL down to the levels of even 50 milligram, 30 milligram, it is possible to get the reduction in the cardiovascular morbidity and mortality. If that is the convincing evidence what you have, you should not get worried or disturbed by your WhatsApp message or your internet message. Primary prevention trials, secondary prevention trials had repeatedly shown that you bring down the LDL, you get the maximum benefit. In fact, heart protection study did not identify the ideal LDL goal beyond which the benefits were not seen. So that's the message. And the cholesterol treatment trial is collaborators again shown that if you are reducing the LDL to the levels less than 70 milligrams, you do get maximum benefit. There is convincing evidence from genetic studies, PCSK9, which had started talking about the clinical outcomes. If the PCSK9 raised, you do get problems like familial hypercholesterolemia. If it is reduced, LDL cholesterol will come down, and the reduction. 4-year trial, I don't want to dwell here because of the lack of time. The 4-year trial is a trial which had used PCSK9 inhibitor Vijayakumar. It was given in the form of injection subcutaneously. Compared with the placebo, 2.3 years of follow-up, had come out with an excellent data of 15% reduction in the primary endpoint and 20% reduction in the secondary endpoint. They had gone to the levels less than 10 milligrams of LDL, 20 milligrams of LDL. They had reached. In spite of that, they did not observe any sort of safety issues occurring as a result of injections given along with the statins. The last month, the ODYSSEY outcome trial was published. Alirocumab, yet another PCSK9 inhibitor, which was used in acute coronary syndrome patients along with statins, had come out with this data. They wanted to keep a target between 25 to 50. That was a target. But they allowed some people to reach less than between 15 and 25 also, that LDL levels. That has gone to show that there is a reduction not only in the mass, but what is important, all-cause death. This is the first time that we are seeing that all-cause death has come down by using alirocumab over and above statin therapy by 15%. In the same study, people who had 100 milligrams and above LDL cholesterol has shown marked improvement in using alirocumab. And not only the morbidity, 24% reduction, but also the mortality, nearly about 29% reduction in the mortality has been shown in those people who had been maintaining the levels of LDL cholesterol 100 milligrams at the baseline. So, ladies and gentlemen, the journey so far that we had witnessed in the field of lipidology is projected in only one slide. That's all. We had seen any number of trials. I started talking about cholesterol and atherosclerosis right from the time when 4A study was published. 4A study was published. It is marked as number one. Then the CARE study. We had got a lot of information by analyzing all this study. Initially, people thought cholesterol is bad. Then average is not good. Then we brought it down by HPS study, by PROVE-IT 22, and the TNT study. Then we thought lower is the better. After the publication of IMPROVE-IT study where they added acetamide with a simvastatin, they found it is better. That means lower is even better. And now the 4-year trial with using PCSK9 inhibitor and the alirocumab, which had used the ODYSSEY trial, had come to show that the lowest is the best in reducing the LDL cholesterol to get maximum benefit for our patients. So, ladies and gentlemen, I am sure probably you will get impressed by this sort of statement that lower is the best and lowest is the best. Before I end my talk, I need to tell you that being the Vice Chairman of the Lipid Association of India, actually we took a huge burden of coming out with some consensus statement in the last 3 years. We published the first statement in 2016. Last year we published the second statement in the International Journal. I'll tell you, keep the levels less than 50. First academic body which started giving this message to the entire world is Lipid Association of India. The credit goes to Lipid Association of India, ladies and gentlemen. Thank you for patient listening.